Hi, everyone. My name is Ileana Rodriguez, and this is my health advocacy plan, Increasing Adult Immunizations in the United States. So I originally started with a focus just on the shingles vaccine and increasing the rates for that. As I did my research and really developed an idea of what policies I wanted to change, I realized that it could be more broadly applied to all adult vaccinations. And so I changed my goal to be about increasing the rates of adult vaccinations by promoting awareness in adults, removing barriers for physicians, and changing policy that affects coverage for adult vaccinations. So let's go into a couple of statistics about adult vaccinations. So the CDC reported that in 2020, only 21.8% of adults over the age of 19 received their full immunization schedule, which currently has 13 vaccines. Looking at specific demographics, only 15.9% of all Black adults and only 17.9% of all Hispanic adults were the ones who received their full immunization schedule. Looking at it by age group, only 8.2% of adults aged 50 to 64 and only 27.6% of adults aged 19 to 49 received their full immunization schedule. The largest driver of this low coverage is the low rate of herpes zoster vaccination, which is the shingles vaccine. So looking at our advocacy group, in this scenario, I'm going to consider that the group has experience in lobbying, grant writing, and has community relationships. So for the strengths, the experience in advocacy campaigns, the ability to acquire grant funding, and the ability to mobilize the community and utilize volunteers to push forward the policy change are going to be the biggest strengths. For weaknesses, there's a lack of experience in communicating with media and large organizations. So that's going to be something that they have to learn as a group. And there's a lack of a health professional within the group to validate the approach. For opportunities, there's currently no campaign that's exactly like ours, but there's definitely the opportunity to identify a partnership with similar groups. And there's currently not a time constraint for the policy change, which could potentially limit the sense of urgency or give you a lot of time, just depending on how you look at it. Threats would be that the message could be warped by future health crises. So, for example, the way that vaccination became a very hot topic during the COVID-19 pandemic, you could have that happen potentially again, and the message that we're pushing could be misconstrued in the media. And policy change to federal programs is incredibly challenging. And so that's, I think, the biggest threat for the group. So let's look at how the needs assessment was done. So initially, I looked at serving vaccine eligible adults to see where they're at and what barriers they encounter. Then I found that there was already some research done on this specifically. And so the questions that I did were really tailored around what those barriers that were previously identified were to see if they were the same ones within this community group. So I won't go through all of the questions, but those are there. So going into that barrier research that I found, adults reported that there were a couple of different things that really stopped them from receiving their full immunization schedule. And the top one was a lack of knowledge or a lack of knowledge of what the need for a vaccine is or the consequence of not getting a vaccine. Next, they talked about how there's a barrier with the lack of coverage, either from their insurance provider or a lack of access through their physician. They also reported skepticism and conflicting information from mass media, and that there's a lack of or very weak recommendations from their physicians. When a physician recommends a vaccine, they're much more likely to get the vaccine at that point. Physicians, in turn, also reported very similar barriers. They reported a lack of or delayed reimbursement for vaccinations. They reported an uncertainty of what the vaccine needs for their patient group was, and that could in turn lead to loss. So, for example, if they stock the hepatitis B vaccine in their office, they're incurring maintenance expenses for keeping those there, but also if they aren't utilized, they end up being a loss because they expire and then they weren't used. And so the practice loses money at that point. And they also reported insurance coverage barriers. And so when those are encountered, the physician just doesn't talk about the vaccine that the patient might need because they know that their coverage isn't there, and they also don't have the resources to provide them information on where else they could get it. A lot of times a vaccine may be received at a pharmacy at a lower cost, but then physicians also run into the issue of not having that health record live within this primary care record. So that research reported that only 29% of internists and only 32% of family physicians screen for immunizations during each primary care visit, which is very low. So looking at the current state and policy, Medicare Part B only covers 3 in-office vaccines: influenza, pneumococcal, and hepatitis B. Medicare Part B, which is the pharmaceutical coverage, covers all other vaccines, but interestingly enough, it only started covering the shingles vaccine in January 2023. And with that Part D, of all Medicare patients, only 58% of them enroll in that additional Part D coverage. So as far as pushing for policy change, which would be to increase the coverage of adult vaccinations under Part B, which would then increase reimbursement and allow physicians to really increase their ability to provide those vaccines in office, we identified 2 U.S. representatives. So Mark Pocan, who co-sponsored the Medicare for All bill and continues to work in that same vein of policy change, and Representative Jan Schwowski. So she is the chair of the Democratic Caucus on Aging and Families, and she had some statements on her website that were very much in line with what we're trying to do. This group would require a lot of information, and we would be really pushing them to do the policy change at the federal level for Medicare. As well as that, we do have a media plan that would include a website that would have resources for physicians and patients, and a call to action to email your U.S. representative. Color-wise, bright, clean, easy to find info, all of the signs of a good website. And for social media, we would look at Facebook, Instagram, TikTok, and LinkedIn, and really tailor the post to match the platform while maintaining a visual identity so that everything is very cohesive, whether it's on the website or on a social media platform. These would also include calls to action. They would alternate between resources, links to the website, and we would definitely use paid advertisements to elevate our post. And lastly, we would make sure that we want to measure our success and our progress. So I would, this group would in particular would look at biannual checks at adult vaccination rates, the audience sentiment and progress as far as how the U.S. representatives are feeling, how the group that we surveyed are feeling about the thing that we're pushing for. And we would also look at the website and social media metrics to see where our reach is. And lastly, if we were able to successfully push for a policy change and that policy change goes through, we would want to make sure that we check to see that that change is maintained. There are a lot of lobbying groups that are working to change Medicare. And so even if we change it one year, it may not be that way the next year. So there would need to be a continuous check on that as well. And that's my advocacy plan. Thanks for listening, and I look forward to seeing everyone else's.